I have seen a couple of nerve injuries related to positioning. One was not a spine surgery, but regardless, it teaches a lesson of how important positioning is. And some patients will have two different type of surgeries, anterior and posterior. And when you position them differently. One is a lateral, one is a prone position. It becomes very important, especially with later on, if you want to sort out whether, especially in the lower extremities, if the injury is related to the actual surgery or it's position related. So it becomes very important. Those kids children that I saw, both of them were teenagers, and they had temporary nerve injuries, but it's kind of it's very uncomfortable to the patient, very uncomfortable to the caretakers for us too, to see that after you labored so much.
Was it in the lower extremity?
Both of them were in the posterior extremity, both of them were in the ulnar nerve, which is the most common nerve that's affected by positioning. What I do is, especially with spine surgeries, is in prone position, it's not only how much you're flexing the elbow or how much you're going abduction and adduction of the shoulder joint, but it becomes the relationship of the shoulder in relation to the elbow in a plane position on the sagittal section. So what I do is probably when they're in a prone position, leaning down, I put a roll to lift the shoulders up into to push them backwards so that the nerves are not extended like this. Okay, so and people have their own way of dealing with this. Try to make the appropriate position, but you have to see stretching, bending, all those things have to be avoided, and that becomes very, very important.
Are you concerned about perioperative vision loss with any of these patients?
Absolutely. Always, when I discuss with parents and patients, I always raise this point of possibly blindness. But from the pattern that we have, there are a certain group of patients that are relatively exposed to this type of complication. But it has to be always kept in mind. You have to make sure there's no pressure on the eyes. You have to make sure there is adequate blood pressure. The mean pressure is inadequate, and anemia is another risk. So we have to keep all that in mind. And yeah, every time you do a spine case, positioning is extremely important, whether it's for the eye or for the